All right, guys, welcome to our next episode of our Let's Talk About Poop podcast, where every week I do a deep dive on a topic you guys are asking me about, and we go over questions you guys have sent to us as well. So if you're new to this channel and to this podcast, my name is Dr. Islam. I'm a board-certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating patients with GI issues. I treated thousands of patients with IBS, reflux, heartburn disease, you name it, wherever your food goes, I go as well. If you haven't already, come see us at Lubbock Gastro. We can take care of all your GI needs. And every week, I either go live on my live stream and I do a podcast to answer your questions as well. So if you want to learn more about what you can do to optimize your gut health, tune in every week. We can give you the information that you need. So we have a great show today. We'll talk about a couple different things. We'll talk about some of the trigger foods that can make IBS symptoms worse. 5 trigger foods. We'll talk about exactly these prebiotic and probiotic sodas, which I've seen a lot on the internet and in the shelves about some of the benefits, supposed benefits about these sodas. We'll talk about some of the foods I recommend to take for gastritis. We'll talk about some of the foods I recommend to avoid from gastritis. And we'll talk about what you need to know about anal cancer as well. And if you're joining me on the live stream, on my social media pages or on my TikTok page as well, that way we can hopefully give you guys more information and let you know exactly what is going on for your gut health. So before we begin, a couple of housekeeping things. So if you're here locally in Lubbock, you can come see us, Lubbock Gastro. Our office number is 806-696-4440. We're seeing patients with all sorts of GI issues. So if you have a gut issue that you want to find an actual answer for, to find out what is going on and to get you feeling better, come see us and our team so we can see exactly what's going on and hopefully get things taken care of you. On a second note, I am so excited. I hope you guys are as well about the start of football. I'm a huge football fan. I'm even a bigger Longhorn fan. So I cannot wait to see how the season goes. Well, let me know in the comments down below if you're feeling the same way as well. So let's go ahead and start with our first topic. What exactly are some of the foods that I would recommend when it comes to gastritis? So let's talk about first, what exactly is gastritis? I have a lot of patients that come to see me that have been diagnosed with gastritis, and they're wondering, hey, what do I do? What is going on? What exactly can I avoid and not avoid? So gastritis, the definition of this is inflammation of what is going on in your stomach. Gastric is stomach, and itis is inflammation. So whenever you have inflammation going on in your stomach, that is called gastritis. Now, there are a lot of different reasons why people can have gastritis. So one of the more common reasons are certain foods that you eat that can make gastritis symptoms better and foods which can make them worse, which we'll talk about. But there are other things you can ingest that can cause you to have gastritis. So alcohol. Alcohol is a biggest risk factor when it comes to gastritis. That can very commonly cause inflammation to occur and cause irritation to occur. And over time, that gastritis can also lead to ulcers and bleeding and problems like that. Another cause for gastritis besides food and alcohol includes smoking. Smoking is a very common cause of gastritis, and that smoking, those carcinogens, that nicotine can impede the blood flow going on into the stomach, and also directly impact the stomach as well to cause inflammation. Another cause are certain medications you may be taking for other reasons, the most common one being NSAIDs, so Aleve, naproxen, Advil, Motrin. These are medications that can tear up your gut. And commonly in my clinic, a lot of my patients that have gastritis is because they take these medications that they take for other reasons, for pain, for example. And then lastly, another cause for gastritis is an infection called H. pylori. H. pylori is a very common bacterial infection that we can get basically through any interaction we have with our environment, even certain foods, and that over time can cause inflammation, irritation, ulcerations to occur, which is also a very common cause why people can have gastritis. Now, we talked about the causes, we talked about some of the reasons. If I saw somebody with gastritis and we talked about what things to avoid, obviously we want to eliminate all those triggers, what are foods that I recommend to help soothe the gastritis to get you feeling better? Here are the foods that I recommend. So number one, I really do recommend a fiber-based food. Fiber is the foundation for gut health. It is the foundation for everything to improve your gut health. And without this foundation, you're not going to feel better and your symptoms will get worse as well. So what we want to do is give you a good foundation like that fiber to help build a foundation to help your gut out to get you feeling better. So the first thing I always recommend is try to incorporate as much fruits and vegetables in your diet to help out when it comes to gastritis, because this is going to be the root cause to help build that foundation to get you feeling better. Number 2 is that you also may want to avoid some of the spicy foods and citrus foods that can make inflammation worse. When you have gut issues, citrus-based foods, tomato-based foods, foods that have a lot of acidity to them will make the inflammation a lot more active. It will make the inflammation a lot more difficult to treat. It will make it harder on your gut as well. So you want to avoid some of those foods that can do that. So tomato-based foods, orange juice, things that have a lot of spice, and lemon juice, for example. These are foods that we want to avoid to make sure we can kind of calm things down. The third food I would recommend when it comes to gastritis is incorporate as much fermented foods as you can. So fermented foods are nature's natural way to give you both the prebiotics, the probiotics, the symbiotics, and the postbiotics, all the biotics that you need naturally for your gut. And these include foods like sauerkraut, kimchi, miso, foods that really have the nutrients, the vitamins, but also the capability to help heal up the inflammation going on in your stomach. Another food I recommend is aloe vera juice. Now, there's not a lot of good evidence for aloe vera juice. However, I do have to say, for a lot of my patients that do have inflammation going on in their gut, like gastritis, aloe vera juice can help soothe the stomach to make it easier so you're not having as much inflammation and to get you feeling better as well. And then lastly, surprisingly, licorice. Yes, licorice or DGL. Licorice is a option that I recommend for both my reflux patients and my gastritis patients to get them feeling better. It is natural and it works really well to help calm down the inflammation and get you feeling better as well. And so I have found that using this really help out when it comes to treating your gastritis and getting you feeling better. Now that we talked about exactly what is gastritis, what are the foods I recommend to treat gastritis, you also want to avoid the foods that can normally cause gastritis to occur as well. So let me give you the foods I recommend you want to avoid. I spoke on this a little bit, but let's talk about this in more detail. So spicy foods, we know that spicy foods and citrus foods can make gastritis symptoms worse. Try to avoid that in the setting of gastritis. Number 2, alcohol. Alcohol is a direct trigger for causing inflammation inside your stomach. So even if you have gastritis from another reason, let's say, for example, you have gastritis because of H. pylori, if you drink alcohol on top of that, that is a double whammy that's going to make things worse for your inflammation and make things a lot more difficult for you to control. And so if you have gastritis, you want to avoid alcohol to make sure you're not causing a synergistic effect on your gut to make things worse for you as well. Number 3 are fried foods and fatty foods. All that fried foods and fatty foods, first of all, they're not good for you. I don't know why you're trying to do this when you have inflammation going on inside your stomach, but that also can cause a lot of irritation to occur. Your body does not absorb those fried foods and fatty foods well. In fact, when you have those foods, what ends up happening is that those foods stay in your stomach longer and more often. The more you have those foods in your stomach, the more gurgling, the more reaction that occurs, the more acidity that occurs, the more inflammation and gastritis you're going to have long term to make things worse for you as well. And number 4 are processed foods. The biggest risk factor for causing you to have gut issues is having processed foods, especially ultra-processed foods. This goes into the same kind of spectrum of fried and fatty foods. These are foods that you can get at any fast food. So if you're having fast food, you're going to Burger King, going to McDonald's, going to Chick-fil-A, which I love as well, and you have gastritis, you're going to make your symptoms worse. It's going to make things more difficult for you and make things harder for you to treat as well. So you have these issues. I want you to make sure that you try to avoid these foods. So these are things that I recommend to my patients when they're coming to see me for the gastritis. It's my protocol that I try to do to hopefully get you feeling better. So if you're having issues with gastritis, this is what I recommend for some of my suggestions to hopefully get you feeling better as well. All right, next topic that we have, so we're here. Perfect. So next topic we're going to talk about are some of the, hey, Dr. Islam, here it is right here. Dr. Islam, what are some of the triggers for food when it comes to IBS? What are foods I need to avoid? And also, what are foods I can maybe incorporate into my diet to help control my IBS? So I like this topic because it really allows me to go into a deep dive on IBS. It's a great question. So IBS is a real disease. Let me just tell you that. It's not in your head. You're not going crazy. And a lot of patients have this diagnosis of IBS and they don't know what to do. So I tell all my patients who have IBS, number 1, it is a real disease. This is what you have. But I also tell them your IBS can be so multifactorial that it may not be due to foods alone. I need to stress this when it comes to my patients, but also to my audience as well. IBS in some individuals is a food-driven disease, but in the vast majority, it's multifactorial. It has to do with stress, food, the gut microbiome, the brain-gut axis, visceral hypersensitivity, inflammation, environment, genetic factors, trauma. All of these things play a role when it comes to what's going on with your gut. And so when I talk about food things when it comes to IBS, you may try dietary changes and it may not work. And I want to stress that is okay and that is normal as well. Because for some individuals, IBS is not a food-driven disease. In fact, I'll tell you the vast majority of people, it may not be a case. However, there are some simple changes that you can make that I recommend to all my patients to get their IBS taken care of. Let's talk about these. So, number one, high FODMAP foods. FODMAPs are certain carbohydrates and starches and sugars that are known to cause gut issues, especially in those individuals who have IBS. These include things like pears, apples, fructose. There's a whole list you can pick up out there. I have a lot of videos on this, but FODMAPs are absolutely 100% the biggest trigger when it comes to IBS. And I've had a lot of my patients who have so many issues who, when they go on a low FODMAP diet, their symptoms get so much better. And the data suggests this as well. The issue with a low FODMAP diet, if you want to go down this route, is that it's very hard to do. And you should not do this long term because you can have a lot of deficiencies that can occur with that. So anybody who we want to be on a low FODMAP diet, we always recommend for you to get the help of a nutritionist as well, because not only do you want you to avoid those foods that can make your IBS symptoms worse, we want you to reinduce the foods that don't cause you to have symptoms. We do not want you to be on such a restrictive diet that you can't eat anything. And unfortunately, when you look at individuals who go on a low FODMAP diet without the help of nutritionists, they end up having a lot of food avoidance issues, which we don't want. And so if you feel like you're going to respond to a low FODMAP diet, talk to your doctor and make sure we can get you the help that you need so we can get you on the right diet with the type of people that may be beneficial for you. The second trigger actually are gluten-related foods. So I want to do kind of a PSA on this. So gluten overall is not something you should be avoiding or should be bad. You're going to read books on, oh, gluten is like the end all be all. It's the end of times. Even gluten's going to destroy everything. We actually do not have the evidence for this. I want to stress this. And so there are some individuals that absolutely have a gluten intolerance. But if you don't have any gut issues and you're feeling fine, don't avoid gluten because you're worried about inflammation. There's no evidence for that. Now, for those individuals that have IBS, a certain subset of them actually do have gluten intolerance. Now, we can't test for that. I can't tell you you have gluten intolerance. We can certainly do some testing to see if you have celiac disease, which is an autoimmune disease in which your body actually attacks itself. But for gluten issues, we actually cannot test you. So the best test is that you try and see how you feel when you avoid gluten. So try to avoid the foods that have a lot of gluten that's there. Now, let me say another part about this is that it's interesting when you look at the studies when it comes to gluten, because when you actually break it down in terms of what they are avoiding, it's actually high FODMAPs. Gluten is a high FODMAP. And instead of actually being a gluten issue, once again, it actually ends up being a high FODMAP issue. And so it really goes down to that. But if you want to try avoiding gluten for a couple of weeks and seeing how you feel, that is your response to that. And I'll tell you, if you don't get any better, you don't feel any better, then don't worry about it. Go back on gluten, go crazy, not a big deal. The third food we want to recommend to avoid are greasy, fatty foods. These 100% can trigger what's going on in your gut. In fact, they trigger what's called a gastrocolic reflex. When you have these foods in your stomach, it triggers the contraction of your GI tract, especially in the stomach, to move things along into your small intestine and to your colon. And this can cause diarrhea to occur. But not only that, greasy foods will sit in your stomach longer and more often and cause bloating, pain, distension, nausea, not make you feel very, very good as well. And so avoiding these foods, it's easy to do. And you should do it because overall, it's healthier for you to not have these foods. You don't want to be eating these greasy, fatty foods that are not good for you that you want to do as well. And so try to limit that. It's an easy fix. And I will tell you, a lot of my patients feel better with that. Number 4 are spicy foods. Now, I have to tell you not everyone's going to be the same. And it's hard here in Texas, especially in the South, to avoid spicy foods. But for a lot of my IBS patients, spicy foods can be a trigger for their gut issues, including acid reflux, diarrhea, and abdominal pain. So try to see if you can avoid that. Just see how you do. So things like chili peppers, jalapenos, the foods that we enjoy here, try to see if you can minimize that, because we have seen some evidence that this type of food can actually make things worse. And then lastly, I know this can be disappointing for people, but yes, caffeine can trigger IBS. So IBS can be caused because you have too much of what's called visceral hypersensitivity. Your gut is just reacting so much, so quickly and so often. And caffeine, as you know, can trigger what's going on inside your brain and your gut as well. It can make things move faster and move along. So it can cause gut symptoms. It can cause pain. It can cause abdominal discomfort, and also can cause diarrhea to occur. And so if you have IBS, especially diarrhea, this may be an option for us to avoid. Now, on the flip side of that, if you have constipation, take caffeine. I actually do recommend this for a lot of my patients who have gut issues. And I'll tell you from my story, for a while I was drinking just a lot of coffee, and I was like, I started to notice, oh my gosh, my stomach is hurting. What is going on? Do I have IBS? And I didn't put 2 and 2 together until I realized, okay, I'm the trigger here. I'm having too much caffeine. This is why I'm having some of the issues as well. So you want to make sure that we can hopefully get that taken care of and get you feeling better as well. Now, a lot of people may be diagnosed with IBS, or you could be self-diagnosing with IBS because you're watching videos on social media, listening to podcasts. But let me tell you, I don't want you to do that. There are a couple of reasons when you need to see a doctor for your IBS. So number one, if your symptoms are not better with what you're doing. So you do not need to suffer when it comes to IBS. You don't need to suffer with diarrhea or constipation or pain. If you just don't feel good, you don't know what's going on, you want to get opinion, come see a doctor, like a GI doctor, so we can see exactly what's going on, because it actually may not be IBS. It could be another condition causing your issues. When you look at the research, there's a lot of intermixing between different diagnoses. IBS, celiac disease, Crohn's disease, ulcerative colitis, and it really takes an expert in the GI field to really piece together what's going on. Another reason to go see a doctor is if you start to have significant weight loss. So weight loss is not a typical symptom of IBS, especially unintentional weight loss. Now, if you're trying to lose weight, that's fine. If you made dietary changes and you're losing weight because of that, okay, that makes sense. But if you have unintentional weight loss, that is not normal, and you need to get that investigated. Number 3, especially if you have diarrhea, if you have nocturnal stooling, if the diarrhea wakes you up in the middle of the night, no matter how bad your IBS is, it should never wake you up in the middle of the night. This is the one question I make sure my medical students, my residents, and my fellows ask anybody who has diarrhea, is that, does the diarrhea wake you up? Because if it does, that's not normal. Next is that if you have a new diagnosis of IBS over the age of 45. So if that's the case, it actually may not be IBS. What I worry about when someone to come see me who's over 45 and they have IBS is there something bad going on inside the colon, like a colitis or a cancer? Because if that's the case, it can certainly mimic symptoms like IBS, but actually may not be IBS as well. And then also if you have rectal bleeding as well, bleeding's never normal. I don't care what anyone says. I don't care what anyone tells you. You should never have blood in your stool or see blood. If you see this, come see us, come see a doctor so we can see exactly what's going on and hopefully get things taken care of for you as well. All right, let's go to live stream really quick here. If you guys have any comments or concerns, let me know. Thank you guys for watching on my social media channels and on my TikTok as well. So if you guys are on TikTok, come join me as well, so you can hopefully get some more information for what's going on for your gut health, and so we can get you taken care of. Perfect. All right. All right. Thanks for guys watching. Perfect. All right. Next question here. Hey, Dr. Islam. Here we go here. Perfect. Hey, Dr. Islam. What are my thoughts on these? Sorry, let me find it. Here it is right here. Hey, Dr. Islam, what are my thoughts on these prebiotic and probiotic sodas? So I went to Costco over the weekend, like I go every weekend, and I've been seeing these prebiotic sodas all over the place. And I'm like kind of wondering, all right, what is this? I saw this in Shark Tank. What is going on? Exactly what's the dealie with this? So you may have seen these prebiotic and probiotic sodas that are being promoted all across America. It's like $1 billion industry right now. Let me take a look here. I was looking at the data earlier. So Poppy, for example, is one of the leading categories in these prebiotic soda space. Apparently, it's been market capped in a couple $1 million, $100 million in 2023. Holy moly, why did I not get into this space to begin with? I'm a GI doctor, why shouldn't I? So what exactly is going on? So these kind of prebiotic sodas, what they are doing is they're actually adding an ingredient called inulin, which is a fiber to give you the fiber that you need, that we all need to kind of live the life that we want to live. So you guys know, if you've been watching this channel, I am obsessed with fiber. Fiber is the foundation for gut health. It needs to be, it should be, and fiber is what you need. And too many of us, including myself, we are fiber deficient. We don't have enough fiber. And so there's a gap between how much fiber we need and what we're actually taking. Now, it's easy for me to tell you, hey, eat more fiber, but it's hard to do because fiber is in a lot of plants, a lot of vegetables. We don't have a lot of that in general. And you actually have to have a good amount of that food to get the fiber that you need. And so these soda cans, these prebiotic drinks, they have the prebiotic fiber inulin in most of them, and they're hopefully going to give you the fiber that you need. Now, when you take a look here, the average fiber is not bad. It's just between, what I can see here, about 10 to 15 grams per bottle, which is not bad. We try to aim between 25 and 40 grams of fiber. So what are my thoughts as a GI doctor on this? So I'll tell you, any fiber is better than no fiber. And so if there's a way for you to get your fiber, that's gonna be the important thing. The best way by far to get fiber is to have it with eating. So foods that have a lot of fiber, plants, vegetables, by far, this is the number one source. This is your way to get you the best fiber that's based in nature, that's natural, has a lot of vitamins and minerals. That's the best way. If you're aiming for getting more fiber, the number one thing you can do is have a variety of plants. That's number one. Number two, if you can't do that, having some sort of fiber supplement is going to be helpful. So there are a lot of ways you can do this. You can take things like Metamucil, Benefiber, Citrusol, or even these drinks if you want, because these drinks have a good number of fiber. Number three, the good thing about these drinks is that it allows you to carry the fiber with you. And so if you want to have that fiber with you, you can have that. Typically, these drinks are sweetened with stevia, so they don't have a lot of calories or sugar, but just kind of be careful depending on the brand because you don't have so many calories with that. Make sure there's not a lot of sugar because usually they don't have sugar in them. But if you can do that. And then lastly, having these types of drinks is 10 times better than maybe having a regular Coke or a regular Dr. Pepper or a regular IC, because at least with these drinks, you don't have the calories, you have the fiber, and you don't have the sugar as well. So overall, I would say these drinks, they're not scientifically proven. We don't have any research for them, but in my opinion, if you want to have a fiber source and you don't feel like you can get enough fiber, either from foods, and you don't want to take a fibrous pill or a powder, this may be an option you can do, especially if this helps break the habit of you having a sugary drink instead, and you're using this instead. So if you want to try it, let me know. I have tried these myself. I personally don't like the taste of them. I don't think they taste very, very good, but to each one their own, not a big deal as well. All right, let's look at the comments here and see if we have any more questions here. Put your questions down in the comment. Let me know if you guys have a question in the comment as well. All right, perfect. Awesome. All right, next question that we have is, hey, Dr. Islam, what do I need to know about anal cancer? So this is a good question because anal cancer is it's not talked about that often in the GI space. So let's talk about this. So anal cancer obviously is a cancer that starts in the very bottom of the rectum called the anus. And the most common reason why people actually have anal cancer is from an STD called HPV. And HPV you may have heard about from other cancers as well. It's associated with other cancers, but this is the most common reason why people get anal cancer is having HPV in the rectum, which can cause a lot of issues to occur. Now, once again, it's not a very common cancer that you have. It's about 1 in 500 people, but the symptoms of anal cancer can present similarly to other symptoms that you may have noticed as well. So what are the main symptoms of anal cancer? Well, the first one is rectal bleeding. So rectal bleeding, like I mentioned multiple times, is never normal. It's not something you should have. It's something that certainly can be a sign of something going on inside your GI tract as well. So rectal bleeding is a common symptom, not only of anal cancer, but hemorrhoids, of fissures, and other things going on as well. Another common symptom is having some drainage coming out from your bottom. Now, once again, drainage can also be normal. It is sometimes normal to have mucus. It is sometimes normal to have that drainage to occur, but it can also be a sign of a cancer going on as well. Number 3 is having a lump in your bottom. You feel a lump in your bottom or something coming out. That's also a very common symptom of anal cancer as well. Next is itching. Oh yes, rectal itching or anal itching commonly is due to hemorrhoids or a fissure, but absolutely there are a number of patients that have rectal itching in which that itching is actually could be a sign of anal cancer. I've actually diagnosed individuals with anal cancer when they had rectal itching as their main symptom as well. Also, if you have a new change in your bowel habits, this can also be a sign or symptom of some sort of cancer, including anal cancer, because if you have a cancer in your rectum, that rectum will cause you to have difficulty with things to pass through, which will make it more difficult for you to have a bowel movement, which will cause that change in your bowel habits. So what are risk factors for developing anal cancer? So I mentioned the big one, having HPV. Having HPV infection is the number one risk factor for developing cancer in the anus. Number 2 is having high risk sex. So having multiple partners, not using protection, having issues like that, or having lifestyle problems, or having lifestyle choices like that can certainly cause you to have risks that can lead to anal cancer as well. And also, you have a history of anal warts as well that can lead you to have anal cancer. So when I have someone to come see me who I'm worried about anal cancer, what do I do as a GI doctor? Well, the first thing I do is I just do a rectal exam. You can see a lot of things that are going on the rectal exam as well, so they give you a better idea of what is going on to hopefully get a better idea to get you taken care of. Number 2 is sometimes we'll use an anoscope to see visually what is going on as well. Number 3, I may also want to consider taking a look with a colonoscopy so I can get a look to see what we can do to get you taken care of as well. And so maybe a combination of these, which will give us the answer for what is going on. If we diagnose somebody with anal cancer, we have to do the typical treatment like we do for any cancers. We'll have you see a surgeon. We'll have to have you see a cancer doctor so we can have a comprehensive team to find out exactly what's going on. I'll get the best plan for you as well. So that usually is what we do whenever it comes to anal cancer, to get a better diagnosis, to find out exactly what is going on. All right, guys, perfect. All right. Well, I think we had a great show today. We had a lot of people join. I want to thank you for watching. If you like what you see, if you like what you hear, don't forget to subscribe to our channel, subscribe to my podcast. If you want to see us live in Lubbock Gastro, come see us Lubbock Gastro. We can find out what's going on, get down to the root cause of why you're having the issues, and hopefully get you feeling better. Hopefully, I'll see you guys next week. Have a safe week. Have a safe day. I look forward to seeing you guys on future videos. Thanks and take care.